Alright, so this is part 3 of our liquid facelift video. I'm Dr. Seiler, and we're going to treat the cheeks and the nasolabial area and the jawline here for what I call the liquid facelift, which is using a couple of syringes of Juvederm to recreate the proportions of the face. She's had this done a couple of times. We're doing a couple of new things in her. We finished her nose earlier today, and we just did her upper and lower lip in a different video. And she hasn't had the cheeks in this area done yet, so this is her first time, even though she's had the other areas done a couple times. So we've already done the numbing shot that I talked about in the first video, so you can see that this is a really easy procedure to get through. The only downside is they have a couple hours of numbness afterward with the numbing shot, but it makes a huge difference with the pain tolerance. So what you can see in her is that the normal peak of the cheek should be right about here, and this is something that a lot of novice fillers aren't able to really see, but you see that with age you start to fall just a little bit, and her skin's in very good shape, but the peak of her cheek is more here than it is back here. So what I'm going to do is I'm going to take just a little bit of filler, and you don't have to put a lot in here. People are a little worried when I talk to them about this that it's going to make them look like they've gained weight or that they've got a fatter face or something like that, and it really doesn't happen. This just gives them a nice, more oval cheek. It's probably a little difficult to see on the camera screen, but we're almost done with this, and you can see this is real easy for her to get through. It's not bothering you too much, is it, Miss Jenny?
Mm-mm.
She doesn't really need that much, but the other thing is too is that with the next couple of weeks this will absorb water a little bit, which is why I like Juvederm so much. So it will help give her a little bit more of a fill. You can already start to see that she's got a nice little bit more peak of a cheek. Alright, look straight for me there. Alright, same thing on this side. You can see that her cheek is falling just a little bit, and she's got a little bit more prominence of tissue there when it really should be more like this. So you can see that if you miss this and you just go right to filling this area of the cheek without filling this area of the cheek, you can see that what just a little bit of pull will do on that area will already take the pressure off of what we call the nasolabial fold. So this is where an advanced filler will really do more facial volumizing as opposed to line filling. A little poke, and it makes the overall result much, much better. Because if you don't fix the problem, just going and filling that area with filler is not going to help them, because you still have the heaviness of the cheek and slightly asymmetrical or off proportions of the face. So you really don't need that much filler in this area to give them a nice little fill. I'm only using a half of a syringe total between both sides here, so sometimes we require a little bit more, but she's got good tissue, so we don't really have to put that much. Hang on to that for just a second. I just kind of massage this in to make sure that it's nice and uniform. I'm going to hold just a little bit of pressure. She had one little spot that she bled in right there, so I'm going to have my assistant come over here and hold pressure for me. I'm going to switch to the other side. Thank you. Right there, good. Alright, so we used one syringe of Juvederm to do her upper and lower lip, and about a half a syringe of Juvederm to do her nose. And we actually used, we used a half a syringe here and in part of her upper lip, and another half a syringe in the rest of her lip and her lower lip, and then the rest of that syringe in this one. So we've used about a syringe and a quarter. She had a little bit left over from her previous syringe, so we're about to use our second syringe here to do the rest of the areas. You can see in her, this is going to be real easy for her to get through. She shouldn't even feel it. Did you feel that at all?
Mm.
A little poke?
Mm-hmm.
Okay. Let me know if you need a little bit more numbing shot, because I can put more in. This doesn't really require that much now that we've given her a little bit of a cheek augmentation. And the goal here, especially in her, who doesn't want anything abnormal or anything shocking, is just to give her a subtle result here with just a little bit of filler, helping kind of recreate the tissue volume that you have when you're a little younger, and recreate that upside down V of the face. It's probably a little hard to see on the camera exactly the result that we're getting immediately with this, but we are getting a nice little result here. Yeah. And we do have before pictures of her that we're going to with her permission, put up on the website. She's been so nice to let us film her doing this, so we'll see if that's okay with her. Alright, and now you can see that we're going to do just a little pinch down here in the jaw, find out where she's lost a little bit of volume. Okay, lean your face forward and up for me. Alright, so this is a good example where she's just starting to kind of see a little bit of a curve right there where the jowl is a little heavy, so we're going to put just a little poke. That one kind of stings just a little bit, even though we've done the numbing shot. You okay?
Mm-hmm.
And that's going to give her a nice little rounded off. My assistant's over there shaking her head up and down yes, because she loves this part, because we did this on her and we made a nice little difference in her jawline there. I'll put just a little bit more right up here in the top. And that's it right there. The good thing about Juvederm is that if it's done correctly, you won't really feel it in there, so the patient doesn't feel like they've had something done. Okay, open up for me. Feel me kind of massaging this just a little bit to make sure it's nice and soft and even, which it is. Alright, close down. Kind of rub that just a little bit there. Alright, now we're going to have Miss Kim hold pressure over here for just a minute to make sure she doesn't have any bleeding. You can see she didn't bleed at all from this area. Alright, got 2 fingers there to hold. There we go. Grab another gauze real quick and we'll finish up the other side and we'll be finished.